Doctor, she's not eating properly. She's always cranky. Always she wants milk.
Hi, I'm Dr. Amit Saxena, consulting child specialist. These are amongst the common complaints that we come across in our busy OPD practice. And though non-specific, it might point towards an underlying diagnosis of anemia. Anemia in children is very common and because of multiple factors. It can range from a simple thing like nutritional deficiency to more sinister causes like hemolytic anemia or even malignancy. Iron deficiency is the commonest reason why a child may be anemic. In India and also in Asia, more than 50% of children are suffering from iron deficiency anemia. In a survey done by NFHS 4 in 2015 and 16, they found that 57% of children were anemic. This figure rose to 67% in a survey done in 2019 and 21. The irreparable damage that anemia in childhood can cause to the development of a young child on one hand, and on the other hand, the availability of knowledge and the mechanism to control it makes this silent morbidity absolutely unacceptable. The elimination of IDA is a public health priority given its association with the impact it has on the child's overall development. So what can be done to prevent this from happening? First of all, we all know that a healthy mother gives birth to a healthy baby. So the mother should receive iron supplements from second trimester onwards up to the pregnancy so that the child is born with adequate iron stores. Followed by this, exclusive breastfeeding for the next 6 months will also help in retaining the iron stores as the breast milk iron is very efficiently absorbed. Advice about complementary feeding from 6 months onwards is a very fruitful step towards maintenance of a good iron store. The sources of food which are rich in iron are these. It's important to note that iron can be found in vegetarian as well as a non-vegetarian diet as well. Starting from 6 months onwards, we also start children a low dose of iron supplementation at the rate of 1 mg per kg per day, which helps in overall development of the child because iron is not only required for formation of hemoglobin but for other metabolic pathways as well. Anemia can be diagnosed clinically by observing paleness of skin and mucous membranes. It's important to correctly diagnose the cause, and it can be done by good clinical history, physical examination, and careful interpretation of reports. If a child is found to be suffering from IDA, then we start treatment with oral iron supplements at the dose of 3 to 6 mg per kg per day, and it's given for 3 to 6 months to replenish the iron stores completely. At the same time, a complete adequate dietary advice is essential, otherwise the child will become iron deficient again.
But she won't eat vegetables. How do I feed her?
That's true. Children may not accept the greens very easily. So it's important to make the food interesting. It can start right from the time of buying the food. You can take the child when you're buying the food, when you're preparing the food as well. Also, it's important the family has lunch and dinner together. When the child sees that you are also eating the same food, the child will accept it even better. And last but not the least, do not give up very easily. Sometimes the child may take 4 or 5 or sometimes even 25 times to finally accept a food. It's also important to treat the underlying cause. For example, if worm infestation is the cause of anemia, adequate deworming is a must. On this Anemia Day, let's pledge to make India anemia free. Thank you.